Hi everyone, this is Dr. Saiti, Team MDS Conquer. So next I am going to discuss about the advanced imaging part 1, and here I am going to explain you of how to interpret a CT image. Okay, so in the part 1 I will give you a detailed explanation of how to interpret an image related to computer tomography, or that is the CT image. So first you need to have an idea of how the various tissues or various structures look within a CT image. So bone and calcium and acute hemorrhage are usually white. Okay. The brain parenchyma is light grey, the CSF is very dark grey, and air or the cavities which contain air, they do not attenuate the X-ray beam, right? So they appear to be completely black, and those include the nasal cavity, the sinuses, and the mastoid air cells. So this is how the tissues or various structures look within a CT image. So just have an idea for this. So now the CT numbers. So CT numbers are actually represented as Hounsfield units, okay, and that lie at a scale of water has -0, air has -1000, and bone is up to +1000. So this is a various CT numbers of various tissues. So just have a look. The bone is about +1000, soft tissue is +40 to +80, water is 0, and air is -1000, and fat is -60 to -100. So just have a look of this various CT numbers, which is represented by Hounsfield units, because slight memory based, but it's a bit important. Okay. So now just a small mnemonic to remember of how to interpret. So first you have to look for the assessment of the asymmetry. So A is asymmetry, where you have to assess all the slices and you have to compare one side with that of the other. Okay, so you have to assess for the asymmetry. Next, B is for blood. So you have to look for acute hemorrhage, which appears to be hyperdense. So in CT image we call it as hyperdensity and hypodensity, whereas in a normal conventional radiograph we call it as a radio opaque and radiolucent, right? But in CT we call it as hyperdensity and hypodensity. Okay. So few tumors, acute blood, the bone, and any presence of artifacts of foreign body appear to be hyperdense, and hypodensity is again by edema or infarct and also the air. So this is how you have to have an idea. So the CSF spaces you have to look for, right? And you have to assess the size of the ventricles and the sulci in proportion to each other within the brain parenchyma. And S is for the skull and scalp. So you have to look for the scalp for the soft tissue injury. So all this is actually not important for us, but the head and neck CT is actually important for us to interpret both the anatomical landmarks as well as if there is presence of any abnormality. You have to have a good idea of how to interpret the CT image related to head and neck. Okay. So this is how the normal CSF spaces look as shown in the picture. So just have a glance of it. So coming to the salivary glands, salivary glands has a CT number, especially the submandibular, has a CT number of 35 to 60 Hounsfield unit. The superficial lobe is ovoid shaped mass, whereas deep lobe has to be enhanced on constant contrast administration. You have to give a contrasting agent to get an enhanced view of a deep lobe. Okay, and lymph nodes shows increased density. So this is regarding the submandibular gland as shown by the arrow in the picture, as you can see. And parotid gland appears to be hypodense, and it is about -10 to 10 Hounsfield units. So you have to enhance with it with the contrast administration. Okay, so this is how you have to have an idea of how to interpret a salivary gland on a CT image. So just remember the CT number of parotid gland, it is -10 to 10, and submandibular gland it is 35 to 60. Okay. Yes. In axial sections, if you see the lower axial sections 8.5 mm posterior to the ramus of the mandible, you have to try to locate the facial nerve as well. So this is just a little idea of how the salivary glands look on a CT. So now we'll go in detail with the others. So just look at the pictures and give a good glance to the pictures that I have posted. So this is a carotid canal which appears to be a darker grey in color, and this is a jugular foramen. Okay. So if you see here the same on the CT, it looks like that. Okay. And for our interest, that is a mandibular condyle. So it looks like, since it's a bone, right, so it appears to be white or hyperdense structure. And the mastoid air cells, since it contains air, they appear to be completely black or hypodense, right. So this is how they can post a anatomical landmark in a CT and ask you to identify. So this is how you have to identify. So mastoid air cells, a group of air cells which are completely black, and the condyle, it appears to be hyperdense or white as shown in the picture. So next, if you see the foramens, so the foramen ovale and the foramen spinosum. So exactly in the skull, if you see, the bigger one is the foramen ovale and the smaller one is the foramen spinosum, right. So like that you have to identify. Next, again here if you see just the inner parts of the ear, this is the internal auditory canal and these are the ossicles malleus and incus. Okay, so just give a glance to that, it's not that important. And now if you see the axial view, so axial section is like, so for example, if you draw a diagram like this, half, if you do that, or if it's a structure like this, if it is done as half, then it is called as sagittal section. So we get a sagittal section if it is done at half. If we do half like this, then you get an axial section. Okay, so this is how the axial section is being taken. And if you do a section like front and back, then that is called as a coronal section. Okay, so now this is an axial section which shows a frontal sinus, right. So here you can see it is a frontal sinus. So since it consists of air, it is completely black. Now this is again a sinuses where you can see the ethmoid sinus, the sphenoid sinus and the carotid canal. So here these are the ethmoidal sinus, the smaller ones. This one is a sphenoid sinus. So sinuses appears to be black. Okay, so like that you have to remember. Next, the maxillary sinus, it's very easy to identify because it's pyramidal in shape. So this is the maxillary sinus and these are the pterygoid plates. Okay, so if you see, these are the pterygoid plates, right. And the third one, here it is a nasopharynx. The fourth one which is present in between, which is dividing the two nasal cavities, is our nasal septum, right, and these are the turbinates. Okay, so these are the fifth one is a turbinate. So just have a look of the maxillary sinus and the pterygoid plates, okay, and the nasal septum, that is more important. Okay. Now coming to the one more view or the one more section of the given for the sinus taken axially. So again the maxillary sinus you can identify, and the second is the hard palate. So between the maxillary sinus, if you see, there is a hard palate and the mandible, right. This is the mandible on the either side as you can see, and the fourth one is a masseter muscle. So muscle is a soft tissue, so it appears to be less less dense when compared to the bone. Bone is hyperdense and it appears to be completely white, whereas muscle appears to be less dense and appears to be grey when compared to that of the bone. So here this is a very important picture for us. So these two are the maxillary sinuses. The second one is the hard palate. The third is the mandible, and the fourth which is attached to the mandible is our masseter muscle. So just give a good glance to this, right. So next coming to the coronal section. So coronal section, as I said, it is taken like front and back. So if we divide like a section to be front and back, so we obtain a coronal section, right. So here if you see, the first one is a frontonasal suture. So suture appears to be like a thin line, so it is a frontonasal suture, and this is obviously the frontal sinus, and the third one is a nasal bone. So, if you can see, it is a nose. So, above the nose obviously the sinuses will be frontal sinuses, right. On the sides of the nose it is a maxillary sinus, like which is pyramidal in shape, and above the nose it is a frontal sinus, and there is a suture that is nothing but the frontonasal suture. Okay. So, just give a glance to this as well. And if you take a coronal view now, this is the ethmoidal sinuses, okay, and these are the one which is present down, the inferior turbinate, and one that is present in between is the middle turbinate. Okay. So, just have a good idea of the ethmoidal sinus, right. The pyramidal shape is this maxillary sinus, but the one which is completely adjacent within the nasal cavities, if you can see, are the ethmoidal sinus, right. So, and also have a look of the inferior turbinates and the middle turbinates, right. So, this is how you have to have an idea. So, this pyramidal shape is a maxillary sinus, and here you will have the frontal sinuses, but this section didn't show the frontal sinus, but it has showed the ethmoidal sinuses. Okay, that's important. So, now again one more coronal view which gives you the maxillary sinus and the nasal septum. So, the bigger one, which is almost pyramidal in shape, is a maxillary sinus, and its number 2 is the nasal septum, right. So, again if you see, this is a hard palate which is being shown, and that one is a sphenoidal sinus. Okay, this is the coronal section which shows a sphenoidal sinus. So, that is it regarding the sinuses of how they appear, which is quite important, and the mandible and the hard palate of how it appears in a CT image. Okay. So, if you take now, if this is a scan level, now you can see the maxillary sinuses, the zygoma as well as the sphenoid sinus. So, just have a look of the sinuses and the zygoma. So, zygoma, as you can see, it is a curved structure, right, which is radio opaque and adjacent to the maxillary sinuses. So, the two completely black pyramidal shape is a maxillary sinus, right. So, and at the base of the skull at this level you will see the sphenoidal sinus as well. So, just have a look of this, and at a lower section if you see, you can get the condyles, right. You can get the condyle nicely. If you see here, this is our maxilla, right, and also there are mastoidal air cells, there is a nasopharynx, right, and there is an external auditory meatus. Okay. So, for us the mastoid air cells, as I said, the condyle, the maxilla is essential for us to identify in a CT image, right. So, see, all the sections will not give you all the important anatomical landmarks. In a particular section which has been provided to you, you have to identify the anatomical landmarks given in that section. Okay. So, they cannot give all the sections because they take many sections for a particular structure. So, one section which is being provided, you have to identify the important landmarks given in that particular section, right. So, if you see here, so the previous one we have seen the maxillary sinuses, right. In this section we can see the condyles, the maxilla, the hard palate, sorry, the mastoid air cells, and even the hard palate, right. So, even hard palate can be seen here, and the nasopharynx, external auditory meatus. So, all this, right. So, this is how you have to identify. Okay. Now, at a still a lower level if it is taken. So, first this is a little upper level, right. So, if the level is here, so obviously we get the maxilla, the hard palate, the condyles and all that. So, here if you can see the mastoidal air cells, the nasopharynx, etc. Now, if you go to a little lower level, you can go for the complete mandible. So, it is the mandible that is being obtained here, and the previously we have seen there is a muscle which is being attached there, that is the masseter muscle which is present bilaterally, right, and the pterygoid muscles, right, which are present on the inner surface. So, outer surface you can see the masseter, whereas on the inner side you see the pterygoid muscle, right? And this is a parotid gland, which, as I said, it is hypodense. It is having less Hounsfield units, right? So on the either side, you can even look for the parotid gland. So this, at this scan level, you get the mandible and the muscles associated with the mastication, that is the masseter and the pterygoid muscles, right? So now if you go to the still lower level, below the head and up at the area of the neck, you can see the submandibular gland, which is little more dense when compared to the parotid gland, right? And you can also see the epiglottis, you can see the sternocleidomastoid muscle and also a subcutaneous fat. Okay, so fat, as I said, it has less Hounsfield units, so it appears to be hypodense again. So this is how you have to identify the sternocleidomastoid muscle, the submandibular glands, which is again very important. Okay, that is done. Now we have seen of how the normal sinuses and the normal structures within the head and neck, which is quite important for us, how they look in a CT image. Now if there is an abnormality, so if there is a fluid accumulation, if there is sinusitis, so how does it look? It will not be completely black, it will be like grey in color, right? So if here you can see there is a fluid accumulation in the maxillary sinus, so that's the reason it has turned into grey. And even in the ethmoidal sinuses, as you can see in the other picture here, even that has turned into grey, because it could be any abnormality like any fluid accumulation or any presence of polyps like that, right? So it will not be completely black. So like that you have to know it whether it is normal or whether it is abnormal, right? So as you can see, it is opacified because it has turned into hyperdensity when compared to completely black, right? So it is opacified maxillary and mandible sinus. So similarly here, if you see, it is opacified maxillary sinus again. So the patient has a surgery on right sinus to create a nasal enteral window to improve the drainage. So here they have created a window in order to get the drainage. So here you can see, when compared to one side, as I said, first you have to look for the asymmetry, right? So if you see the symmetry of the coronal scan here, the left side is like completely, the patient is having opacified maxillary sinus, that means hyperdense. It is not black, so it has, the density of the sinus has been increased. So like that you have to differentiate from one side with the other. Okay, so similarly here, this is a normal one, right? And here it is abnormal. So this is a normal frontal sinus, right? Here you can see the posterior wall of the left frontal sinus has been destroyed, either could be reason like bacterial invasion. So that you can observe in this axial section of the CT sinus. Okay. Next, here if you see, there is a fracture segment, right? So that has caused the edema, okay, and fracture at the site. So there is an edema, fluid accumulation and the fracture, so that you can see here. The second picture, here you can see there is a fracture segment as well as there is edema, right? So this is how you have to identify, and you have to compare one side with the other, and you have to come to a conclusion whether it's normal or whether it's an abnormal in a given CT image, right? Now here if you see, there is a tripoid fracture, that is zygomatic frontal suture and the zygomatic arch as well as maxillary sinus wall. All this, there is a 3 fractures there. So one is here, just a second. So one is here, one is here, and again here. So there is 3 areas, that is nothing but a tripoid fracture. So zygomaticofrontal suture, the maxillary sinus wall, and also the zygomatic arch. So all this is just, you have to identify the lines of the fracture. So trauma to the maxilla can actually occur at 3 sites, which is causing the tripoid fracture. Okay, so just have a look of this. Now in this, if you see, this is a normal submental vertex view, the jug handle view, wherein you can clearly see the zygomatic fracture, and similarly in a CT if it is taken, even that shows the zygomatic fracture. Okay, so the zygoma is not like a complete curved structure here, it is being fractured and it has been displaced, right? So like that you have to differentiate whether it is normal or whether it is abnormal. Now if you see, this is a case of a 24-year-old patient who is having an impacted molar with a radiolucency around it. So axial section, if you see, you can see a radiolucency around the impacted molar, and even in coronal section you can see the impacted molar has a radiolucency which is attached to the crown of the tooth. And in the 3D volume rendering, so what happens is this CT image, if it is not that clear, they do a 3D volume rendering, that is a three-dimensional image, they get it. They have, the computer itself has some sophisticated algorithms with which the 3D volume rendering can be done so as to get a 3D image of the structure. So that clearly shows if there is a lesion, and it clearly shows or clearly depict the lesion or any tumor or any cyst if it is present. So it will be crystal clear as shown here, right? So this is a dentagerous cyst. So if you see here, there is an impacted molar which has a radiolucency around it, right? So that gives a picture of a dentagerous cyst. Okay. Here if you see this, there is a irregular radiolucent lesion with a periosteal reaction within the body of the mandible. So that shows a osteomyelitis. So here if you see here, there is a little periosteal reaction with a irregular radiolucent lesion. Okay, so that gives a osteomyelitis, and here and there if you can see here, there is osseous fragments which shows a sequestrum. So sequestrum, as we know, it is seen in osteomyelitis. So all this clearly goes to a diagnosis of osteomyelitis, because these two sections can give a conclusion that because of presence of osseous fragments, it could be sequestrum, and here irregular or ill-defined radiolucent lesion with a reaction, periosteal reaction in the body of the mandible. So most probably it could be osteomyelitis, right? Next. Now again if you see, there is a impacted teeth and a ill-defined lesion here, right? So, but it is like the border of the mandible is gone and you can't completely decide of what it is. So in that case you have to go for a 3D CT, and also you have to go for a PET CT. So PET CT is nothing but fusion of positron emission tomography with a computer tomography. So PET is a nuclear imaging which gives a functional abnormality as well, right? CT gives only the anatomical variations, whereas functional variations is given by the nuclear imaging. So if you fuse both, which is called as fusion imaging, you get both anatomical as well as a functional variation of that particular structure. Okay, so especially in cases like if you want to differentiate any malignancies, so it's always better to go for fusion imaging like PET CT. Okay, so PET CT has shown increased FDG uptake, right? So which suggests the malignancy. As you can see, there is increased uptake of the radioisotope, which is the FDG. Okay, fluorodeoxyglucose is the isotope that is being used in PET. So that shows increased uptake, so which suggests malignancy. Okay, and there is a impacted third molar. So lesion contains the crown of the impacted third molar. So the diagnosis they have made it is the squamous cell carcinoma, which is most likely to be derived from keratocystic odontogenic tumor. So this was a diagnosis that they have made, right? So there is an impacted third molar and there is complete destruction of the bone here, and the PET CT has shown increased FDG uptake, right? So if you see here, there is a the CT image shows large radiolucent lesion which is present in the posterior body of the mandible, right, with break or the cortical intact cortical plate has been broken. Okay, so this complete, if the first and third and the fourth three lines, the first, second and third lines say that to come to a diagnosis of a squamous cell carcinoma which could be derived from a keratocystic odontogenic tumor. Okay, so this is the important, like how it is quite important of how to come to a diagnosis if a CT image is being given to you. So they can post the picture, they can also give you the clinical presentation, and also they can give you many options based on that. So you have to arrive at a diagnosis of how to, like, first you should know how to identify the abnormal area, right? Then you have to go and arrive at the diagnosis. So first you need to have a good idea of all the cysts, tumors and all which are related to the head and neck. Then if a CT image is being given to you, it will be quite easy for you to come or to arrive at a particular diagnosis related to that particular image that is being given. Okay, so this is regarding the interpretation of CT. So what I feel is, first have a good glance of all the normal anatomical landmarks that I have presented in this discussion. Followed by that, I have given you the sequence of the various abnormalities like the fractures or the radiopacification of the sinuses or little tumors and cysts, and also the squamous cell carcinoma. So which are commonly given questions are related to these areas. They are asked in and around these areas. So just give a glance of all the pictures. There is nothing to make notes out of it. Okay, so you have to just give a good glance and capture all the images that I have posted. Okay, so that is enough. And if you want to practice, you can have a practice of, like, without seeing the answer, you can just look after 10 days or at least after a month. Don't see the answer which is posted there, just directly look at the image and try to answer by yourself. Okay, so that's enough for knowledge, like that's enough. If you have this amount of knowledge regarding the CT interpretation, that's enough. Okay, thank you.